Hey everybody, it's Dr. Duncan at Siskiyou Vita Medicine, and again, it is Wednesday night, and this is Wednesday Night Live. This is a forum for which our community and our members can submit questions, health questions that they've wanted to know for a long time or just came up. A lot of things happen in the media, so there are things coming at us all the time that maybe you just have questions about. If you do have health questions, please post them in the comments section of the video, or you can post it to our Facebook page, or you can go to our email at admin@siskiyouvitamedicine.com, and you can submit questions there. But we'd love to just bring this out as a forum. It's really laid back. There are no dumb questions. Hopefully I can give a very informed answer, and we can come together to create some understanding around some things that maybe there's not a lot of clarity. Tonight I'd like to talk a little bit about back pain. I see a lot of people with back pain, especially sciatica, SI problems, problematic joints, different things, but primarily back pain. But before I get into that, I'd like to just talk about what's going on around the clinic. So as many of you know, we have Pat Dykes, who's a reflexologist here in the clinic. She's amazing, and if you haven't had a treatment with her, then I recommend that you call and schedule one. It's super relaxing. She's been practicing reflexology for decades, and she has great hands. So it's a real treat to have her here in the clinic, and I'm so happy that she's offering her services here to the Rogue Valley community. So we also have a very special guest in the clinic over the next couple of weeks, and her name is Maria LaPuma. She's an international trained trainer, and she is here to teach people about heart-centered stress management skills and methods that release stress, raise energy levels, and activate natural abilities to heal and raise your skills and your talents to deal with life. So the workshop that she's teaching, and she's here tonight, and she'll be here the following 3 Wednesdays, is that she's going to go over stress awareness, how to achieve more energy, more understanding about your own stress and other people's stress and how it affects you, take-home skills for stress management, and a way forward to further empower your life. And I think that is fascinating, and I think it's very fundamental to learn the skills that will help you empower your life and live a life more full, and a life that more suits you to reduce stress and disease and inflammation in your life. So here's the flyer. This is Maria LaPuma, so please check her out. You can contact her at info@noble-being, being.com. Again, that's info@noble-being.com. So please check her out. Her number is 541-201-8787, 541-201-8787. So please get on that. She will also be here on Thursday, December 7th, and talking about how to navigate holiday eating with confidence, learn effective strategies and practical steps. So if you're going to come by Siskiyou Vita Medicine, pick up one of these flyers, share it with your friend. It's going to be engaging. Ron and I did a little talk about how to navigate eating around the holidays, especially and specifically geared around Thanksgiving, which I know a lot of us sort of overeat, and I've had a lot of confessions after the holidays, so it's pretty fun. But we can definitely learn more all the time, and if you think you know it all, then you probably don't know much at all. At least that's my philosophy. I'm always open to learning new health tips and tricks, because all of us have our unique experiences. So that's what's kind of going on around here. Coming up in January, we have a life mastery class. I don't know if you can see this, with our very own Ron Battelle, and then he'll be joined by Lindsay Robbie and Emmy Graham. Lindsay and Emmy are Kundalini practitioners, and they do a wonderful job. And Ron will be talking about the sensory systems and the experience of your true self. And this is going to begin January 8th, and it goes on January 8th, the 15th, the 20th, the 29th, from 5:30 to 7:30 here at Siskiyou. I would really, I'd like to encourage all of you to attend this class. This is a great way to start the new year. It's about going through your physical, mental, and emotional bodies to give you the skills to live your life with a mastery, to be a master of your own life, and to really be in control of how you respond to your environment, whether it be food or stress, relationships. And so the description of the class is become the master of your life. With this transformative monthly class series, students will explore subtle human physiology, which I'm super interested in, spiritual alchemy, experience vibrational sound healing, and practice Kundalini yoga techniques to expand self-awareness, awaken creative potential, and connect to the soul. So, I mean, that's kind of a lot, but I think it's going to be amazing. I'm going to sign up for the class. On Friday nights, we do a sound bath here, and a sound bath is essentially coming in, doing a short course of Kundalini, and then doing like a 30 minutes a meditation while being surrounded by these vibrations coming off of these Tibetan singing bowls or these glass crystal bowls, and a gong. And the last experience I had was pretty amazing. So I definitely take advantage of the things going on around here because they give me an opportunity to just take a break, and I get to experience something new that I haven't experienced before. And living here in Medford, you know, there aren't that many things going on, but we have a lot going on here, and we're trying to bring a lot more to you in the community, and we're trying to bring a lot more to our members, especially because we're promoting health, and sort of health and wellness is our business model. If some of you know us, then you know that we practice direct primary care. We have a direct primary care model. I like to call it naturopathic direct care, actually, because it's more than just primary care. We work on really root cause of illness and looking for what's really going on in your life, and then approach everything from a foundational wellness aspect. So we're really trying to fix or to help you discover what it is that's really going on, so that way you can live a sustainable life and live a life that's on your terms. So that's what's going on around the clinic. So back pain. So a lot of people come to me and they're complaining of back pain, whether it be low back pain or mid back pain or even sciatica. Some people are experiencing pain that goes down the leg or refers into their feet. And a lot of this can be due to a couple of reasons, and I want to go over those reasons. But first I want to tell you that I personally experienced sciatica, severe sciatica, for 2 years after I herniated a disc in my back. So I'm going to bring out my model here to describe what that was. So this is a model. This is the spine. This is only the spine, and this is the pelvis. So we're looking at the front, and this is the back. The blue portion right here is the sacrum. This little green piece right here, if you can see that, this is called the tailbone or the coccyx, and then the lumbar spine starts here where it turns red. The sciatic nerve is made up of a bunch of single nerves that come out of the lower spine and the sacrum area, and they come out of this little notch right here. And I don't know if that's super clear, but I'll turn it. So that comes out of this notch and it runs down the back of the leg. So what I did about, let's see, I think it was like 4 or 5 years ago, maybe 6 years ago, is I herniated the disc. And this model here really shows that. This is a bulging disc. You can see on the side there's a little, this is the spinal disc right here. This is what separates each section of the spine or the bones. And this little piece just bulged out and it pushed on this nerve right here. And when that pushes on a nerve, that causes inflammation and pain and swelling and, you know, symptoms to shoot down the leg sometimes. And in my case, that's what it was. It was the symptoms that really traveled down my leg, and it prevented me from doing a lot of things in my life. And those of you who've had sciatica or know of someone who's had sciatica, you know it's debilitating in a lot of cases. So I got into injection therapies, primarily prolotherapy and Ozone, to address my problem. I was offered, you know, I went the conventional route in the beginning, and I was offered antidepressants, and there are reasons behind that for that prescription. If some of you don't know, antidepressants are commonly prescribed to help break the pain cycle. So I was offered antidepressants as well as pain medication and surgery. But the more I looked into the research, I found that there was really a difference between those who received a surgical procedure or underwent a surgical procedure to repair herniation and those who did not, and those who did more of an active recovery, doing more physical therapy and reducing inflammation and, you know, sort of changing the biodynamics of their movement in their body, actually did a lot better. Interestingly, a lot of us walk around with herniated discs, but not all of us have symptoms. So I figured, well, heck, if somebody else can have a herniated disc and not have symptoms, why not me too? So I started looking around, and what I found was a therapy called prolotherapy using dextrose and procaine. And after about 8 treatments, I was able to walk and stand and lift my children and play and drive all without pain again. So it took me about 2 years to find it. And so I'm really excited that I can offer it here for people who are looking for a solution, a non-surgical solution or a non-pharmaceutical solution to their back pain. So first of all, back pain is very interesting in that, you know, we all sort of have this low back. I get a lot of this, you know, my back is spasming in this area. You know, it really hurts here. And what I've found over time and in my practice and just through, you know, speaking with other physicians and doing research is that a lot of back pain actually comes from the low spine and a muscle called the psoas muscle. So the psoas muscle attaches here at the low spine, and it comes down the front of the hip and attaches to the front of the thigh on the femur, and it allows you to lift your leg. So when you're sitting all day, your psoas muscle is actually flexed, so it's in a contracted position. So when you go to stand, you release that contraction, and sometimes you'll feel that backache. So if you notice, you know, when you stand up and you reach back and you sort of reach down and you stretch back and gosh, you know, that back really hurts. Well, first thing you should think about is how long have you been sitting? And then you think of your psoas muscle. And so this psoas muscle is being contracted all day long. It's sort of like me flexing my bicep, and don't laugh at my muscles, but this bicep, if I'm to flex my bicep for four hours, you know, I don't know how long people sit, 6-8 hours at their jobs, at their desks, so it's kind of crazy. But if I flex that bicep for that long, and then I go and straighten my arm, that's going to start cramping. It's going to hurt. I'm probably going to have symptoms. So it's sort of similar here. And so what the first rule of thumb is to rule out any psoas issues when looking at back pain. The other problematic area for back pain and sciatica is actually this joint right here. This is a joint between the hip and the sacrum. This is the sacroiliac joint. And you can see right here on the model, there are a bunch of yellow fibers. Well, this is a representation of nerves that run through here. And like I said, there are nerves that run through that connect down into the sciatic nerve that pops out below. So a lot of times people will have back pain, and they even have hip pain. So you have pain in the front and the back, tight hamstrings, and then pain that shoots down the leg. It can sometimes be due to this joint right here, and this is the sacroiliac joint. So this joint can get rotated forward, it can get rotated backwards, but what happens is there's actually a ligament right here, and ligaments attach bone to bone, so it's providing structure for the musculoskeletal system. And so when the ligament is compromised, the muscles sort of take over, and they get hard and they cramp. So if you've ever had a muscle spasm, or if you know somebody that's had back pain and they feel like, you know, there's a rope in their back, or their muscles feel like steel cables, it's because the muscle's cramping to take the place of a compromised ligament. So nerves feed their way through muscles. They sort of weave through. So if you were to ever dissect an animal, or if you've ever butchered an animal or been through an anatomy lab, you'll know that nerves will feed or weave their way through muscles. So the muscle that's cramping down is really squeezing these nerves, and then that's resulting in pain in your foot, or it could be pain in your lower leg. And so to look at the SI joint is super important. So, you know, see a naturopath, see a chiropractor, or an osteopath, and they can help you figure out whether or not you have a dysfunctional SI joint. It's really pretty easy. If your leg length is different, and if it's not you know, something that you inherited at birth, then it could be due to this rotation of a hip. So check out your leg lengths. If you're experiencing hip pain, or if you're experiencing tight hamstrings, or just sort of this general low back pain, then consider SI dysfunction and consider a tight psoas muscle. So foundationally, stretch the psoas muscle. We're always sitting, right? So this thing is always contracted, this huge muscle. So you can stand up and simply do a runner stretch, or you can get on the table, or you can get on the bed or on the floor and do a cobra. Just really stretch that front line and get the muscle to lengthen and give these muscles in the back a little break. So back to my story. So as I said, I herniated a disc a while ago, and I had severe symptoms, and I had prolotherapy done. So prolotherapy is essentially going and treating each of these nerves with a dextrose solution. And the dextrose solution causes a little bit of irritation, and it's sort of like having the acute injury all over again. It's getting the immune system's attention and getting the immune system to come in and sort of resolve the chronic inflammation that's going on, as well as like clean up any injury. So what I do is I combine dextrose and procaine, and I like to use procaine because the procaine sort of resets the nerve. It sort of erases trauma out of the tissue. And if any of you have been in an auto accident, you know that trauma can stick around for a really long time. So I like to just ensure that we're treating the tissue memory. So tissue sort of has a memory with it. So we treat the tissue memory, but we essentially go in around the nerve root. So you know these little nerve roots right here. We go in and we treat that. And we put some medicine around that, and we help decrease the inflammation in that. But we also, in doing that, strengthen the connections between the spinous processes or the transverse processes right here. And we also do this procedure, or I do this procedure, down in the sacrum as well, because there's, like I said, there's very large ligaments that maintain the structural integrity. And if those get compromised, then we need to shore those up to ensure that the muscle isn't doing a job that it's not supposed to be or not designed to do. Muscles are designed for movement, ligaments are really designed for structure, so or maintaining that integrity. So what I do is I go in and I'll treat the nerve root that's affected, and then I'll go in and we'll treat the ligaments that are affected. So if you've been to either a naturopathic chiropractor or an osteopathic physician, and you keep getting an adjustment of this sacroiliac joint, like, oh, your sacroiliac joint's out, you know, and you keep getting an adjustment, it keeps coming out, keeps going in, keeps going out, then consider that this ligament is lax, like there's laxity in the ligament, that we need to tighten that up. So the therapies that we utilize are designed to help shore that structure up, to make sure that, you know, you're treating the root cause, so you're not continually getting adjustments and continually dealing with low back pain, hip pain, or sciatica symptoms. So the other ingredient that I like to use a lot is called ozone. So ozone is a gas, so I fill up syringes with an ozone gas, and the ozone dissociates in the tissue, means it comes apart in the tissue, and part of it is oxygen. And it happens to be that these ligaments here have very poor blood supply, and they're poorly oxygenated, and it takes them a long time to heal. So by injecting ozone into the tissue, we're actually oxygenating the tissue, and we're also causing inflammation. So, you know, I talked about the dextrose, and I talked about the procaine, and the dextrose causes irritation, and the ozone actually causes irritation in the tissue, and it stimulates fibroblasts, and it stimulates growth factor, so it basically gets your body in gear and starts healing what's wrong. So we like to fix what's wrong, right? So the ozone goes in. The injections really aren't that bad, and that's a direct quote from hundreds of patients that have received treatment from me. It's sort of, I like to compare it to an acupuncture appointment. We're not being really traumatic to the tissue. We're not causing a lot of tissue damage. It's really placing the ozone, or placing the dextrose, placing the procaine, and letting the body do the rest. So we're just giving the body the tools it needs to do the healing. So a typical treatment for sciatica, low back pain, would be to address any sacroiliac issues. So that's an injection right into this joint, so you might be able to see it better from this side. So we go right in here, and that's to bathe the ligaments as well as the nerves to simulate a healing response, to make sure that we're addressing any structural issues. and decreasing inflammation and increasing oxygenation of the tissue. For a herniated disc, we'll identify through either MRI or CT what level the disc is herniated and what level the spinal root is being compressed. And then we'll go right down into that area and put a little medication and reduce the inflammation. Interestingly, you can have, like I said before, you can have a herniated disc without symptoms. So as long as this nerve is able to move freely with movement, then it'll remain relatively happy. But as soon as it's pushed on, if there's pressure on it, and this foramina right here, this little hole where this nerve comes out, this is called the foramina, and you'll see this on an MRI. It's called foraminal narrowing, where this hole gets narrow, or because you'll lose disc height and this nerve will swell. So this little hole, what we try to do is we try to reduce the size of this nerve. We just try to take the inflammation out of the nerve, and the nerve actually shrinks down. And so we get the nerve to come back down to a normal size, which makes the hole a lot larger when the nerve is smaller. But we also like to restore the disc height. And this is done through proper hydration of the body, taking in plenty of electrolytes, and in sort of getting your body moving correctly again. Some people will like to do decompression exercises, so they'll hang upside down. So, they'll hang upside down like this, and they'll take pressure off the spine, they'll take pressure off the disc. So that can help rehydrate discs. There's also the Mackenzie's, if anybody's heard about Mackenzie's. Those are really helpful. But like I said, we'll go down and we'll treat the nerve root, reduce the swelling, and hopefully increase this disc space to take the pressure off the nerve. And that's what was done in my case. So in my disc herniation, it was L5. And so what was done is I had an injection around the nerve root and around the disc, and it really changed my symptoms. Within one treatment, I could tell my symptoms were really different. My pain didn't go away right away, but my symptoms changed. It was a different sort of pain. The quality of pain was different. So I knew that something was working. And so I stuck with it, and 7 to 8 treatments later, I was feeling much better. So it's a pretty simple procedure. People don't have to, take a lot of time down. I recommend that people don't take a bunch of antioxidants before the treatment, especially if I'm going to use Ozone, because Ozone is an oxidative stress, and I don't want to negate any of the medication, the effects of the oxidation. So, high dose antioxidants are not recommended. Not taking any ibuprofen or anti-inflammatories is recommended. I like to apply heat to the tissue, and the reason I like to apply heat is because I like to improve blood flow. Like I said before, these tissues have very poor circulation. The ligaments, the tendons, they don't get a lot of blood. So if I can improve the blood flow, I'm doing something, right? Because I'm oxygenating the tissue that hasn't been oxygenated or that is poorly oxygenated, so I can actually speed up the healing process in the body. So I avoid ice. So if there's an injury, I don't ice anything. The body naturally wants to increase circulation, and it sort of brings heat into the area, and I like that. I want to mimic nature. I want to take advantage of the systems that are already in place so that we can get a good, swift healing response. So let's review that. So back pain, think about the psoas muscle. The psoas muscle attaches to the spine, but it comes down the front of the body. So if you find yourself sitting a lot, driving a lot, make sure you stand up and stretch that psoas muscle back. So I like the cobra, it's a yoga pose. And I also like the runner stretch. So basically stabilize yourself, grab your ankle, and pull your ankle back and stretch the front leg. Next is ensure that you don't have a sacroiliac issue. So figure out or get evaluated for sacroiliitis, because that can contribute to low back pain as well as hip pain, and then sciatica, right? And then if you've addressed the psoas muscle and you've addressed the sacroiliac joint, then consider getting imaging or getting worked up for a disc herniation or foraminal narrowing, or some musculoskeletal injury, and typically that's done with an MRI in the lower spine. So that's super helpful. All right, and then if you want to talk about prolotherapy, prolozone, platelet-rich plasma therapy, I'm available. I give free 15-minute consults. If you're already a member, it's no problem. You just come in. There's no charge. to talk about approaches, strategies, nutrition. So, and that brings me to a point, nutrition. So what if you come in and you get polotherapy, or you get Ozone, or you get PRP? What should you be eating to help repair the joint? Well, I recommend eating lots of healthy fats and minerals, and drinking plenty of electrolyte-rich water. And the reason is that we want to ensure that the nerve is happy. We want to make sure that the neural sheath that's made primarily out of fat is happy. Ligaments and tendons like lots of minerals, they like lots of fat. And then we want to support collagen production. So veggies, anything containing vitamin C, minerals, collagen. You can get the hydrolyzed bone collagen by Great Lakes. The local stores around here all have it. I've seen it. It's in the green can, so the green can's the best kind. That's hydrolyzed, it's easy to digest and absorb. So I recommend that people eat lots of healthy fats, of course, always lots of veggies, get your minerals, stay hydrated, and drink electrolyte-rich drinks. My favorite coconut water is Taste of Nirvana. It tastes the best to me, so if you've tried coconut water and you haven't liked it, make sure you try Taste of Nirvana. It's my favorite. So that pretty much does it for back pain. Now, if you're a female and you've addressed everything, you still have back pain, make sure you get checked for a UTI or a kidney infection. If a male, just make sure you get a prostate exam to make sure you're not having any prostate issues that could contribute to low back pain. Because you don't want to blame, working in the yard or picking up your children, for your back pain, and then never address it and get it figured out or evaluated and learn that maybe you have a kidney infection, or maybe you have prostate issues. So, just make sure you talk to a professional, a health professional, to make sure that you're looking at every scenario possible, because you'd hate to overlook or treat yourself and overlook something that's more serious. So that sort of does it for back pain. If you guys have any questions about anything that I've talked about tonight, please send me an email, admin@siskiyvitamedicine.com, or you can email me at drduncan@siskiyvitamedicine.com, or you can just post a comment on our Facebook page. If you know anybody that could use some help, that have been on pain medications for a while or considering surgery for low back pain, sciatica, SI issues, tell them that I do free 15-minute consults. Have them come in and talk to me, and we can sort of figure out whether or not injection therapy is right for them. So that's what I like to geek out on. This is one of my favorite things to do, is to help people with back pain. And it's because so many people suffer with back pain, and I had a personal experience with it. So again, I just want to review that we do have some classes coming up with Ron Vittel starting in January. And we have Maria LaPluma in the clinic. We have Pat Dykes in the clinic. So there's kind of a lot going on here. Also, if you guys like farm fresh eggs, we have farm fresh eggs every Tuesday. So I hope to see some of you around. I hope to see some comments and some questions. If you have any question at all about anything, please post it. We'd love to talk about it. And I wish you all happy holidays, and I hope you enjoyed Turkey Day as much as I did. And come join us on Thursday at 5 p.m. to talk about how to navigate holiday eating with confidence. So I appreciate you guys, and I look forward to next Wednesday night. All right, guys. See you later. Bye.